As India struggles to cope with the Covid-19 pandemic, one of the country's 28 states has stood out in the fight against the coronavirus. Kerala has been so successful in flattening the curve that globally many are now speaking admiringly of the Kerala model for handling public health emergencies. Kerala was the first Indian state to report a case of Covid-19 when a medical student had arrived from Wuhan at the end of January. When India announced a nationwide lockdown on March 24th, Kerala had the most cases of any state. But about 3 months later, Kerala has reported only 544 cases of Covid-19 with only 4 people losing their lives. Kerala has the lowest mortality rate as well as the highest recovery rate with respect to coronavirus infections. The state has a population of about 35 million, and by contrast, the UK with double the population has reported more than 40,000 deaths, while the US with 10 times the population has reported more than 82,000 deaths. So how is it that Kerala could effectively combat Covid-19 when the world at large appeared ill-prepared to respond to this health emergency? The number of tests conducted in Kerala is just 10% of the figures for countries such as the US. But aggressive contact tracing and keeping a large number of people under observation helped Kerala in preventing community spread. 90% of the positive cases were detected among people who were kept under observation. At the height of the virus in Kerala, 170,000 people were quarantined and placed under strict surveillance by visiting health workers, with those who lacked an inside bathroom housed in improvised isolation units at the state government's expense. The credit should also go to Kerala's robust local governance, effective social structure, and well-knit, multi-layered public health structure. The state may be sluggish when it comes to industrial production, but its human development indices are comparable to Nordic countries. In addition to having the highest literacy rate in India, Kerala also boasts a declining birth rate, higher life expectancy, more empowered women, and stronger welfare support for the poor and the marginalized. Kudumbashri, a Keralan grassroots network of local organizations and women's self-help groups, established some 1,200 community kitchens to feed the poor, with 300,000 meals being served per day. When migrant laborers felt unease, they were given free accommodation and food and urged to stay back. These instructions were delivered in migrants' own languages and duly followed. In achieving such impressive results, Kerala has shown the way forward on how to tackle the coronavirus pandemic, not just to the other Indian states but to the entire world.